My name is Dr. Eric Liu, and I'm a surgeon here at the Rocky Mountain Cancer Centers here in Denver, Colorado, where we specialize in caring for patients with neuroendocrine tumors and neuroendocrine cancer. Let's go into a little bit more detail about imaging. Imaging is critically important for patients with neuroendocrine. It's kind of like my ability to see into your body to see how your disease is behaving. But the problem is there are many different types of imaging tests, and they give me different kinds of information. And only with good quality information can I make a good quality plan for you. And that's the goal, is to make the best plan to improve your quality of life and your quantity of life. But if you go to a radiology department at a hospital, you'll see there are many machines that can do many things and take many different kinds of pictures. And they do provide different types of information. Let's talk about the most basic type of imaging. It's actually the CAT scan. A CAT scan is actually a very, very fancy X-ray machine that can create three-dimensional images of your body. So you can see the spleen, you can see the lungs, you can see the heart, you can see the liver, you can see the pancreas, and you can see the bowels. It's black and white, and it's a fixed picture. For neuroendocrine, that's actually very important because you get a sense of how much disease there is. Where is it coming from? It is a widely available test. It's very standardized. Every radiologist knows how to read it. So from that perspective, it's very widely available, which is great. However, for some details, you need other types of tests. Another test we have is the MRI. For neuroendocrine, we frequently use MRI for the liver because it's actually the most precise and it takes incredibly detailed pictures of your body. So when I look at the liver, I want to know not just how big your tumors are, but I want to know how many there are. And the MRI is very sensitive at picking up extremely small neuroendocrine tumors, especially when the machine is tuned just for neuroendocrine. And that can be very important for planning surgery, or planning embolization, or planning PRRT, or whatever therapy you're doing. The most advanced imaging we have specifically for neuroendocrine is the gallium dotatate scan. It's also known as NetSpot. It's a test that I was actually very fortunate to have helped pioneer here in the United States over 10 years ago. The neat thing about it is it's very specific just for neuroendocrine. What it does is it takes pictures of the receptor called the somatostatin receptor, and it gives us a lot of information. It's actually completely changed the way I practice medicine now, taking care of neuroendocrine patients. There's actually yet another generation coming out, something called the DetectNet or copper-64 dotatate. It's very, very similar to the gallium dotatate scan, but it's actually easier to use logistically. So this might be a test that can be used in places that are far away from a gallium generator. So when we combine these therapies, a CT scan, an MRI, a PET scan, and sometimes ultrasound, that's when you can get the most precise information. It's great to have more tools taking care of patients. And we pride ourselves in providing this kind of technology here at Rocky Mountain Cancer Centers. Call my team today for an appointment.